Can babies get the coronavirus disease? We know it is possible for people of any age to be infected with the virus, but so far there are relatively few cases of COVID-19 reported among children. Can antibiotics treat the coronavirus disease? No, antibiotics do not work against viruses. The 2019 nCoV is a virus and, therefore, antibiotics should not be used as a means of prevention or treatment. Does heat kill the coronavirus? Heat at 56 degrees Celsius kills the SARS coronavirus at around 10,000 units per 15 minutes, quick reduction. Who is at risk for coronavirus? The virus that causes COVID-19 infects people of all ages. However, evidence to date suggests that two groups of people are at a higher risk of getting severe COVID-19 disease. These are older people, that is people over 60 years old, and those with underlying medical conditions, such as cardiovascular disease, diabetes, chronic respiratory disease, and cancer. The risk of severe disease gradually increases with age starting from around 40 years. It's important that adults in this age range protect themselves and in turn protect others that may be more vulnerable. WHO has issued advice for these two groups and for community support to ensure that they are protected from COVID-19 without being isolated, stigmatized, left in a position of increased vulnerability or unable to access basic provisions and social care. Can cold weather and snow prevent the coronavirus disease? Cold weather and snow cannot kill the new coronavirus. There is no reason to believe that cold weather can kill the new coronavirus or other diseases. Are masks effective against the coronavirus disease? If you are healthy, you only need to wear a mask if you are taking care of a person with suspected 2019 nCoV infection. Wear a mask if you are coughing or sneezing. Masks are effective only when used in combination with frequent hand cleaning with alcohol-based hand rub or soap and water. If you wear a mask, then you must know how to use it and dispose of it properly. Can the coronavirus disease be transmitted in hot or humid climates? From the evidence so far, the COVID-19 virus can be transmitted in all areas, including areas with hot and humid weather. Regardless of climate, adopt protective measures if you live in, or travel to an area reporting COVID-19. The best way to protect yourself against COVID-19 is by frequently cleaning your hands. By doing this you eliminate viruses that may be on your hands and avoid infection that could occur by then touching your eyes, mouth, and nose. What is the recovery time for the coronavirus disease? Using available preliminary data, the median time from onset to clinical recovery for mild cases is approximately 2 weeks and is 3 to 6 weeks for patients with severe or critical disease. Is headache a symptom of the coronavirus disease? The virus can cause a range of symptoms, ranging from mild illness to pneumonia. Symptoms of the disease are fever, cough, sore throat and headaches. Can coronavirus spread through mosquito bite? To date there has been no information nor evidence to suggest that the new coronavirus could be transmitted by mosquitoes. The new coronavirus is a respiratory virus which spreads primarily through droplets generated when an infected person coughs or sneezes, or through droplets of saliva or discharge from the nose. To protect yourself, clean your hands frequently with an alcohol-based hand rub or wash them with soap and water. Also, avoid close contact with anyone who is coughing and sneezing. Is there any treatment for the coronavirus disease? There is no specific treatment for disease caused by a novel coronavirus. However, many of the symptoms can be treated and therefore treatment based on the patient's clinical condition. Moreover, supportive care for infected persons can be highly effective. Do people develop immunity to the coronavirus disease after being infected? There is currently no evidence that people who have recovered from COVID-19 and have antibodies are protected from a second infection. The development of immunity to a pathogen through natural infection is a multi-step process. Do vaccines against pneumonia protect against the coronavirus disease? No. Vaccines against pneumonia, such as pneumococcal vaccine and Haemophilus influenza type B (Hib) vaccine, do not provide protection against the new coronavirus. The virus is so new and different that it needs its own vaccine. Researchers are trying to develop a vaccine against 2019 nCoV, and WHO is supporting their efforts. Although these vaccines are not effective against 2019 nCoV, vaccination against respiratory illnesses is highly recommended to protect your health. Which are the most common symptoms of the coronavirus disease? The most common symptoms of COVID-19 are dry cough, tiredness and fever. Some people may develop more severe forms of the disease, such as pneumonia. What animals are affected by coronavirus diseases? Coronaviruses primarily infect the upper respiratory and gastrointestinal tract of mammals and birds. What are the types of coronavirus? Coronaviruses are a large family of viruses that are known to cause illness ranging from the common cold to more severe diseases such as Middle East Respiratory Syndrome (MERS) and Severe Acute Respiratory Syndrome (SARS). What precautions should I take while traveling during the coronavirus disease outbreak? Recommendations for international travelers. Perform hand hygiene frequently, particularly after contact with respiratory secretions. Hand hygiene includes either cleaning hands with soap and water or with an alcohol-based hand rub. Alcohol-based hand rubs are preferred if hands are not visibly soiled. Wash hands with soap and water when they are visibly soiled. Cover your nose and mouth with a flexed elbow or paper tissue when coughing or sneezing and disposing immediately of the tissue and performing hand hygiene. Refrain from touching mouth and nose. A medical mask is not required if exhibiting no symptoms, as there is no evidence that wearing a mask, of any type, protects non-sick persons. However, in some cultures, masks may be commonly worn. If masks are to be worn, it is critical to follow best practices on how to wear, remove and dispose of them and on hand hygiene after removal. As for any travel, travelers are also advised to follow proper food hygiene practices, including the 5 keys for food safety, as well as recommendations to reduce the risk of transmission of emerging pathogens from animals to human in live markets. What are differences between the seasonal flu and the coronavirus disease? While many people globally have built up immunity to seasonal flu strains, COVID-19 is a new virus to which no one has immunity. That means more people are susceptible to infection, and some will suffer severe disease. Globally, about 3.4% of reported COVID-19 cases have died. By comparison, seasonal flu generally kills far fewer than 1% of those infected. Is temperature screening effective to detect the coronavirus disease? Temperature screening alone, at exit or entry, is not an effective way to stop international spread, since infected individuals may be in incubation period, may not express apparent symptoms early on in the course of the disease, or may dissimulate fever through the use of antipyretics. In addition, such measures require substantial investments for what may bear little benefits. It is more effective to provide prevention recommendation messages to travelers and to collect health declarations at arrival, with travelers' contact details, to allow for a proper risk assessment and a possible contact tracing of incoming travelers. Who is at risk for coronavirus? The virus that causes COVID-19 infects people of all ages. However, evidence to date suggests that 2 groups of people are at a higher risk of getting severe COVID-19 disease. These are older people, that is people over 60 years old, and those with underlying medical conditions such as cardiovascular disease, diabetes, chronic respiratory disease, and cancer. The risk of severe disease gradually increases with age starting from around 40 years. It's important that adults in this age range protect themselves and in turn protect others that may be more vulnerable. WHO has issued advice for these 2 groups and for community support to ensure that they are protected from COVID-19 without being isolated, stigmatized, left in a position of increased vulnerability or unable to access basic provisions and social care.